Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callendar.
The 2 days after the second injection. So usually the first injection is usually not the problem because except for the allergies, but usually it's the second injection that you get many of the side effects. But maybe next week I can have her on and have her talk to you about her experience with the vaccine.
Oh, that'll be nice.
That would be great.
I'll ask her to come on next week so she can, and I'll give you her a line so she can give her an invite so she can join us.
Dr. Callendar, can allergic reaction to penicillin be a problem with the COVID-19 vaccine?
Yes. But I think any allergy can be a problem. Now, the question is, what in the vaccine are they reacting to? So I think if you're allergic to anything that the vaccine is constituted. Now, if you're allergic to penicillin, that's just an allergy to penicillin. So if there's no penicillin in the vaccine, then that's okay. But there are other things that you may be allergic to that may be in the mixture of what they put together for the vaccine. And
but Dr. Callendar, it sounded as though yesterday they were talking about allergies. And if you carry an EpiPen, well, lots of people carry EpiPens for different allergies, but it seems like you shouldn't get the vaccine. I mean, you have an EpiPen for nuts, fish, whatever. So if you normally have allergies to certain things, I guess my takeaway from it was to not get the vaccine now.
No, you should take your EpiPen with you. Yeah, it's up. It's a risk-benefit ratio. It's up to you whether you fear dying from COVID more than the reaction to the vaccine, and so it's an individual decision. But if you're my age, you probably would take the EpiPen with you and see if you get an allergic reaction, because they usually keep you and observe you for about an hour after you get the vaccine. And especially those people who have allergies, that would be a good idea. So for some people who are low risk, then that's a different decision tree. But for people who are high risk, people who are obese, who are over 65, then it's a different story. But for those people who are 30 to 40, now that doesn't mean that if you're 30 or 40 and you get the virus, you won't die from it, because we have people at all ages dying from the COVID virus.
I have a question, Dr. Callendar. Are you aware of a release form that you would have to sign before getting the vaccine?
For every vaccine that you get, you have to sign a release form. And every vaccine that I got, I had to sign a release form. Didn't you?
Yeah.
Well, this is just no different. It's another vaccine. So yes, you have to sign a release form. Yeah.
I don't think I did one for the flu though, for this latest flu shot.
Oh, I did.
Oh yeah.
Yeah.
I remember signing a release for the flu shot.
I had a drive-through.
Oh.
But I did register online, but I just pulled up and they ejected me while I was sitting in the driver's seat.
Well, I wouldn't recommend that for this vaccine, because
I
wouldn't recommend it. I think
wouldn't.
You need to let them sit down and watch you for
Thanks, Carol.
an hour.
And I was thinking about that before you just mentioned that. For several of the vaccines I had, I think for the shingles, they wanted you to wait, 10 or 15 minutes after you got the shot to check to see if you would have an allergic reaction.
Right, and those are vaccines that were developed over years, so you have more experience with those, where this one is developed in the last year. So you don't have a long-term experience. So when you take this vaccine, you should stay around and let them see how you do for the first. All of those people who got the vaccines in the test, they kept them there for an hour.
Oh, wow.
And observed them. And then after that, then they let them go. Then they called them every day thereafter.
Oh, that's good. That's
and then
nice.
they follow them up by a call every week.
That's good. That's
yeah. And they're still doing antibody tests on those people as we speak. But that's why it would be good to have Gloria, my niece Gloria, come next week, and she can tell you exactly what she went through. And actually, it would be good for you to hear her tell you about some of the side effects of the vaccine.
Dr. Callendar, now your niece, does she have to take this since she got it already, she doesn't have to take it, right?
She already has it.
Huh?
Right. Yeah, she has it.
She has it already.
She has the vaccine already, right?
Yeah. Right, so she doesn't have to take it now.
No, of course, no.
No.
She has it, right.
Okay. And
she didn't have COVID. She was just one of the, she was just testing. She went through the preliminaries.
Vaccine. Right.
Yeah, but she didn't have COVID.
No, but I thought she was asking whether she would have to take another vaccine. She's taking the
that's
vaccine.
what I was asking. Yeah.
Doctor,
and you're a doctor. Now, where would you take it, in the hospital or in a CVS, Walgreens? Where would you take it?
I take it in the hospital.
Yeah,
but,
me too.
Or the doctor's office. I wouldn't take it in the CVS.
No, me neither.
Also, yesterday on the news, they were saying that if you're a transplant patient, don't take it.
Oh.
Right, because if it's they have a vaccine that's live vaccines the transplant patient can't take, but they have one that's not live.
Okay, so is that an extra risk taking it at a CVS?
No, it's just that if you have an allergic reaction, I'd want to be at a place where they're used to taking care of people with allergic reactions. That's all.
Okay, I had my flu shot at a CVS and was done by a nurse practitioner in an office.
That's the standard flu vaccine?
Yeah, the standard flu vaccine.
Yeah, that's okay. Yeah, it's all right, because as I was mentioning, that vaccine has been used time and time again, and we have long-term as well as short-term results. Whereas with this vaccine that's coming up, we have no long-term results. So it's relatively new. So for that reason, I wouldn't take it in the CVS. I don't want to take it in a doctor's office or a hospital.
Me too. Me too.
Where somebody, in case you have a side effect, they know how to treat you. No, I'm not saying that the nurse practitioner doesn't know how to treat you, because they do. Because there's standard treatment for an allergic reaction, as you mentioned with the Benadryl and adrenaline, and so it's standard. I just, especially if you're over 65 now, if you're a youngster, then it may be different for you. But then again, if you're a youngster, you still want to do it the right way. So.
And if somebody gets a cardiac arrest or something, in the hospital, they have everything right there to, intubate and all that, So that's how I would take it in a hospital.
Or a doctor's office. Yeah, doctor's office. Okay. If you have and they have the standard anti-allergic medication available. But I think it's good that people are very sensitive to what's going on in the UK, because the same thing is likely to happen over here, except we'll be a month later. Because it hasn't been officially approved except for emergency authorization, but it hasn't been officially approved in the United States yet. Of course, what is really frightening is the surge of cases of COVID that are plaguing us. What did they say for our area? There was how many cases last week?
The article I just pulled up, that was a national article. I think.
What was it about?
3,100
Yeah,
in one day.
Yeah.
Yesterday alone, 3,000.
Yeah. So it's scary, and I think we're just beginning to see the effects of Thanksgiving. So what's going to happen with Christmas and New Year's Eve?
True. Yeah.
Very scary.
Dr. Callendar. Dr. Callendar.
Yes.
This is Bonnie. Good morning, everyone.
Hi, Bonnie.
Great. My question is related to, I'm allergic to lisinopril. How would the vaccine affect me, or how could it affect me?
Well, if the vaccine has lisinopril in it, then it would be a problem for you. If it doesn't, then it was likely not to be a problem. But since you have an allergic reaction, it's a good idea to go to a place that has anti-allergic stuff handy, which is the Benadryl and the EpiPen or adrenaline. But the risk is if the vaccine is made up of that product that you're allergic to, whatever it is. If it's only lisinopril, it's unlikely that that will be an issue for you.
Thank you.
Dr. Callendar.
Yes.
I have a question. If they could help Trump and his lawyer, why from getting it, completely or save their lives, isn't that possibly a cure for other people that have it to prevent death, or they were just lucky, or they didn't have it that bad?
No, I think that, for example, Carson and Trump's lawyer had it bad, and the antibody treatment apparently is effective. And so I think right now it's only available under emergency usage, but I think the fact that it worked for Carson and Trump, and it probably would work for this attorney as well, that should become soon, after they've done all the tests, standard treatment.
I'm also thinking that those treatments cost a lot of money.
Oh, yeah. That's what I thought.
Yeah, we know right now it wouldn't, because they're experimental and there's no cost for it. But when it becomes on the market, it will be probably expensive.
So they can't use it just for the average person?
Until it's approved by FDA.
Oh, so if you're rich and famous, you can get things that are not approved.
No. There's emergency. Okay, I have to understand the difference between emergency authorization. If you're in a center that is doing research on that product, they can use it. Or if you ask for emergency use of it, then you have it. So, and I think there's certain centers that have it and some centers don't. And what happened, the process is that after you get emergency authorization, then you go for standard approval. And when you have standard approval, then it becomes available to all. Right now, it's limited because they haven't done enough research on it.
Oh, okay.
But of course, the president got preferential treatment. I still say they followed him around, and he got treatment that.
Well, but he went to the place where they have that medication, which is Walter Reed, and as did Ben Carson, right? And I think one of the I think I heard Dr. Frederick talking about this on the program. One of the problems with the process is that if you go to a place that has the medication, then you're in good shape. But if you go to a place that doesn't, you could conceivably die. And that's the inequity that exists that still is a problem. It goes back to access. And in this situation where you have new drugs, they're not available in all locations. And that's the inequity of the problem that you're addressing. That is an issue that is substantial. Because just like you were saying, if you go to another hospital that's different from Walter Reed, and they don't have the drug, then it's not something that you would get. And that's why only a select few have received that antibody treatment. And I think that is going to become the next concern when people look at this situation where you have Trump and Ben Carson and Trump's lawyer getting medication that other people can't get. Now the question is, who will get it, and how? What is the process by which it will be rationed? And you know, you saw that picture of in UK where there's a 90-year-old black woman who was getting the virus because they used the priority to people, the old people in nursing homes as the first, and first responders after that. So the question is who should go next, and that's what people are talking about. When should people under 65 get it? When should the first responders get it? When should people who are 25 get it? Those are the rollout issues, the equitable issues, and that's why it's important to have ethical people in charge of the process. And it's hopeful that people like Anthony Fauci, who's going to head up most of it, have that they're ethical in the things that they do.
I had a quick question, Doc. So everybody has to get 2 shots. Are they gonna wait for the next phase to get treated until after the first phase gets both shots? Or are they gonna?
Well, I don't understand your question, because everybody who gets treated will have 2 shots.
I'm saying the second phase in the rollout, will they have to wait till the first group has both shots before they can get a vaccine?
I don't know the answer to that question because right now, as you have read in the newspapers, they're going to run out of that particular vaccine after 100 million. It's a lot, but and the question is, will you get 100 million people who want to take the vaccine? So you're talking about pretty huge numbers, and it may be unlikely that we get 100 million who will actually take the vaccine. But if we actually have more than 100 million, we have other vaccines in the pipeline. So we've got the Moderna, which hasn't even come out yet, and we've got the AstraZeneca, and we've got other ones. So that it seems to me that it's not going to be a likelihood that there won't be enough vaccines to get around. The biggest problem is going to be getting people to take the vaccine.
Yeah, that's true.
You know, Dr. Callendar, the other thing is that if you are chosen to get this vaccine, it's no point in just getting one. They would have to give you the second one so that you can get the full benefit of the vaccine.
Yeah. Absolutely. Absolutely.
Yeah, I don't think that they would, you know, give one vaccine out and then go to the next person and give one.
No. That was not what I intended to. What I was saying is that if you have enough of that vaccine, fine. If not, they have another vaccine that you could use, so that you wouldn't have to worry about that, because you'd have enough vaccines. If there were only one vaccine, then that would be an issue. But since there's going to be probably at least 3 vaccines, and one of which will be, I think one of them is not associated with the live virus, which will be available for transplant. But I don't know when that will be available.
Dr. Callendar, if you take the Pfizer vaccine first, do you have to take the second vaccine? Does it also have to be the Pfizer, or
Yes.
can you mix the
Yes.
brands up?
No. You can't mix it up.
Okay.
Yeah, you have to take 2 doses of whatever vaccine you're taking. Right.
But if we're running low on Pfizer, and I know they have others coming in, Moderna and Johnson & Johnson, you wait for that Pfizer. The other day on the news, they were saying that the Trump administration or the United States, whatever, somehow, they rejected an order, something to do with the order of Pfizer, a second delivery. Right. And that's why we don't have enough. And then they said, like in Canada, they have enough vaccines to treat everybody in Canada 5 times.
Well, I don't, yeah, but that's true. But as I said, that's only an issue if you only have 1 vaccine. But we've got 3 vaccines, so it really doesn't matter. And I would love to see the situation where we use up the 100 million doses. Yeah. But I'm not sure that I'll see that. I hope so, but because our population is 300 million plus. And but right now, I'd be thrilled if we got 100 million vaccinated. Right. I'm not sure we can get that many. So I don't think that that's a legitimate issue because right now we're talking about who is willing to be vaccinated. Mm-hmm. Not to me, not whether or not we have enough vaccine. So the way in which it's going interesting to see how people act when the vaccine becomes available. In other words, whether there's a rush to take it or fear, and therefore not a rush to take it, and we have more vaccines than we can give out.
Well, Dr. Callendar, can the government mandate that everybody has to have this vaccine?
No.
No.
This is a free country.
Mm-hmm. Yeah.
No, you can't do that. It's up to you. If you want to take it, you take it. If you don't want to take it, you don't take it. That's what democracy is all about.
Yeah. The vaccine doses are going to be free, but vaccination providers can charge a fee for administering the vaccine. So I'm reading where Medicare can charge $28.39 for administration. But do you know what the cost is going to be for non-Medicare?
What?
I have no idea.
Okay.
I have no idea. That's that's where the devil is in the details. So we'll have to wait and see.
Even though so many people are dying from coronavirus, government cannot make that to make everybody take it.
That is correct.
Oh my gosh. Mm-hmm.
Because we're free to die.
Right. Free to live or die.
Right.
Now, this is an interesting article because it talks about because you get the vaccine, that doesn't mean you get rid of your mask. And it talks about the many issues that are involved in terms of whether or not you still need to keep your mask. And the answer is yes. Yes, you need to still wear your mask until most people are actually vaccinated. It's in their best interest as well.
And doesn't it take
not so much about you, it's about others.
Doesn't it take a month for it to actually, after your second shot? No. It takes
21.
It takes you get the second shot within a month.
Oh, within a month, and then you're clear.
Yeah, then you're.
Oh, okay.
Then it builds up, right?
So as soon as you're taking the second shot, you can throw your mask away.
No. That's exactly what we're saying. No. You got to keep the mask on because this article goes on to talk about how it may well be that after you get the virus, after you get the vaccine, you may still for a while have some viral particles that you may be eliminating. So that they think until we have done all the studies that you should wear a mask until everybody's got the vaccine. And until then, a mask will be desirable. And look at it. We can't even make people wear their mask. You talking about making them take a vaccine?
Vaccine. You're right.
You can't even make people take their mask.
You're right.
Wear a mask.
Yeah.
Yeah, that really needs to be communicated very strongly, because after the second vaccine, I can see most people throwing away their masks.
I do too. I think you're right. And articles like this need to be transmitted so that people know that you got to wait. You got to wait until everybody's vaccinated.
Why do people have so much a problem wearing a mask? I mean, I've been wearing it since I was 17 years old. Why are they having problems?
That's a good question.
I don't like them when I'm out walking, because it fogs my glasses up. That's the only reason.
And you can't breathe.
I can breathe.
Very well until you get used to it.
Yeah, I'm used to it.
Well, you know, there's a lot of studies that demonstrate that the oxygen level is not affected by the
mask.
But if you believe that that's the case, and then there are a lot of people who believe that they cannot breathe well when they have a mask on, and that's one of the reasons why some people don't wear masks.
Now look at Dr. Callendar. He's a surgeon. When he's in the operating room, he keeps the mask on. He doesn't take off for hours and hours, 8, 10 hours. And it's okay. I mean, you know, nobody's going to die because you're wearing a mask. And in dialysis, we wear masks more than 10 hours. Only when we go on our break, we take it off.
You know, I think this article is also mentioning that even though you have the shot, the vaccination, that you can possibly still spread COVID without being sick. So that's another reason for still wearing the mask. You could, if you get around somebody that has it, you can still spread it to somebody else without you getting sick.
Even though you're okay, right?
Right.
Okay, so I got to get a cute mask.
Yeah, and if you're around a lot of people who are infected, you need to have a shield as well. But if you're not, a mask is adequate. Yeah.
Carol, I had a cute mask and went into a doctor's office the other day. They made me take it off and gave me one of the medical ones, the blue ones.
Disposable one, yeah.
Yeah.
My goodness.
What doctor was that?
It was an eye doctor's office.
Oh, yeah.
Stopped me at the door. I'm sorry.
Yeah. They aren't as good as the medical masks.
Mm-hmm.
Yeah.
When I went to donate blood at NIH, I had one of those KN95 masks, which are kind of weird, but they also took mine and gave me one of those 3-layer masks.
Yeah.
When I went in to donate, that's it at NIH, so they don't play around.
No, I think that's important.
Yeah.
Yeah.
Because also, I think a lot of people who have that cloth mask and all that, you don't know how often they're washing it or not. It's kind of a danger thing, you know. Some people may not wash it for 2-3 weeks. You don't know. So they have to protect everybody, the employees, the other patients. It's best when you go there that they give you the surgical mask, disposable one. And I agree with that. I agree.
One of the things that bothers me is when I watch these sports events. And you see all these people, they wear masks sometimes. They pull the mask down and they start talking and all that stuff.
Right.
I mean, it's terrible.
Yeah.
Their protocols are awful.
Yeah. Horrible.
The coaches.
And they told them not to spit, and they keep spitting on the, in the field, the football players and all that. Oh.
Yeah. Well, this is a figure that is frightening. 450,000 dead by the middle of 2021. And that's why when you think of the cost-benefit ratio, you have to keep that in mind, especially if you're above 65 or,
Do people,
other questions about that before we change the subject?
Or do people who have had COVID need the vaccine?
No. Generally not. And you can find out by doing antibody tests. And if you do the test and find out that they have antibodies, then you don't need to, they wouldn't need the vaccine. But some of them may not have high antibody titers. If they do not have high antibody titers, then they would need the vaccine. So one of the best things to do for them is to have an antibody test and have them evaluated to see if they have neutralizing antibodies.
Dr. Callendar, when you supposedly when you get the vaccine, it's supposed to help you to build up your antibodies to COVID. So if they do this test that you're talking about to see what your antibody level is there any way that a person who had their antibodies to COVID-19 built up their antibodies so high that they can do an experiment or some kind of a test to see if you can do some kind of a blood transfusion to help the second person?
We are already doing that. That's already been done. That's one of the treatments, is take the plasma from a patient who's recovered and give that to another patient. So that's already being done. That's one of the treatments.
Okay.
Okay, let's go on to the next one then. Okay, there's no more questions. Now this is an interesting article that talks about the kind of pain that you should never ignore. Of course, I don't know any pain symptom that you should ignore, frankly. But especially a pain with a loss of function. Eye pain that comes out of nowhere, because glaucoma could be the issue. Shingles, as Darryl talked about, I think anybody who's had shingles would understand. About
I have PTSD when you say shingles.
Oh no! Oh. Just the mention of it, huh?
Oh yeah.
And any chest pain, you know, as far as I'm concerned, chest pain is a heart attack until proven otherwise. And then severe headaches. Now, if it's a headache that goes away with an aspirin, that's okay, but not else. I had a good colleague of mine who was on blood thinners, and he bumped his head, and actually he died from it. So when you're on blood thinners, you have to be careful about accidents. Severe abdominal pain. Some people like to treat themselves with pain in the abdomen before they go to see the doctor, which I think is a mistake. And if you have severe abdominal pain, you could require surgery to save your life. Calf pain with the pulmonary embolus, blood clots that kill you, it's important to take it seriously. And any minor wound that persists, you have to be sure that if it persists, you get it treated, because it can be infected. So the bottom line is, anytime you have pain anywhere that persists, you probably need to see your doctor. Now, when I say that, one of the issues that comes up is, how easy is it to see your doctor? And the answer to that question is, that's why emergency rooms are around. If you have any difficulty seeing your doctor and you have severe pain, go to the emergency room.
What about kidney stones? Anything that's, or
especially kidney stones.
How would you even know it's a kidney stone? You just have the pain, right?
Yeah, that's all you need to know. If you have pain that doesn't go away, that's all you need to know. Then you need to go, because they make the diagnosis after you go to the hospital, take X-rays, or and that kind of pain is not going away. So you're going to have to go someplace get some medication. So.
But won't the doctor label you as a, what is it, hypochondriac or hyperchondriac?
A wise doctor does not do that.
Well, how do you find a wise one?
Amazon.
Carol.
Leave it to Carol. What? Well,
Aren't you talking
in these
to
days,
one?
most emergency rooms now have people who understand that people come to the hospital to get treated. But in every profession, there are people who are unwise. So what can I tell you? And there are people who label you as a drug addict because you see.
Yeah, that's true.
And they're dangerous people. So I think Carol's question is legitimate, but and that's why it's so important to have a, we raised the issue of a patient advocate the last time. To have somebody with you, because you have to have somebody who, you in so much pain, you can't speak for yourself. So you need somebody to speak for you. So it's a good idea when you have that kind of situation. Take somebody with you who can speak for you.
Yes.
Are emergency rooms COVID hotspots?
It's unlikely. It's unlikely that they are anymore. At least when you have these surges, they may become hotspots. When you have these surges like now, when we have talking about 3,000 cases as put up before, then they can become it. And so that's why a lot of people have not gone to the emergency room. But if you have pain like that, you don't have any choice, because whatever that situation is could kill you. And so you have to take your chances.
Yeah.
But the legitimate question that you asked is a good one. When you have these surges, it's possible that the emergency room could become a hotspot.
Dr. Callendar, if you have to go to an emergency room, do they triage you for COVID now?
Yes.
They also test you. Okay.
Yeah.
And they have rapid tests now.
Okay.
Those hospitals.
Okay.
Go ahead.
The pain chart, every time you go to the hospital or someplace and they have these little smiley faces and you have to label your pain from 1 to 10.
Right.
Well, what if they say that, they think that females sometimes can endure more pain than a male?
Oh boy.
That a pain to a woman, a 10 would be the same as to a 10 to a man.
A 10 is a 10 is a 10 is a 10.
But don't some people experience a 10, and to you that wouldn't be nothing?
No, 10 is a 10. The 10 is the worst pain you can imagine. That's a 10. So whether the man, woman, child, or whatever, it's a 10, and so it has to be dealt seriously. There was the allegation that blacks could stand pain more than anybody else, so you don't have to give them pain medicine. Yeah, that was ridiculous. Just as if, but we do know that women can bear pain more than men. That's a fact. But
can be what?
That's just, everybody knows that women can bear pain more than men. That's what known fact.
Bear pain, not be a pain.
No, bear pain.
Oh, okay.
And a 10 is a 10. If it's a 10 for you, it doesn't matter who you are, then it's a 10.
Also, Dr. Callendar, I was going to ask you when you said go to the emergency room. Now, my doctor's office told me now out of every 50 patients, 2 of them are positive for coronavirus. So now they, wearing everything, and they don't do coronavirus tests, but they tell them to go to other places to get it. So she told me cancel all your appointments till March.
Well, that's a personal opinion. I don't have any problem with that if that's what she recommends. I think what she's saying is that if you don't have a serious problem and you can wait until March, it'd be better off. And that's good advice. But we're talking about pain. If you have pain, you can't wait for that.
Right, absolutely. And then some insurance won't pay for you, like Kaiser Permanente. You have to call them first, their clinics. And they have to okay you, and you have to go to their clinics.
Well, that's for a clinic, but for emergency room, there's legislation that requires the emergency room to take care of you, whether you have insurance or not.
Oh, okay.
There's a special legislation that requires you to be taken care of whether you have insurance or not.
Oh, okay.
Okay, next slide. This is an interesting one on exercise. I'm not sure I agree with all of this here, but anyway, it's interesting to see that they are more sensitive to the need for exercise in the young and less of a need for exercise in the old. When I personally think it's more of a need for exercise in the old than it is for the young.
Right, yeah.
But they are indicating that 1 in 4 adults and 1 in 8 teens do not take enough exercise. And I think especially if teens are not athletically inclined, they tend not to appreciate the value of exercise. But when you get older and the muscles start waning, the importance of exercise to me increases. And this article takes a look at the updated guidelines, and look at this. 60 minutes a day, 5 to 17.
Oh my gosh.
But that's only 3 days a week.
Oh,
it's still 180 minutes.
Oh, okay, that's not bad, yeah.
Yeah, and then 18 to 64, it goes back to the 150 minutes.
Why is the cutoff 64?
I don't know, and that's why I take issue with this article. Because it says 65 and older. They don't need to exercise as much, and I don't agree with that.
Is there something magical that happens with your body when you reach 65?
Well, they think that because of chronic conditions or disabilities, it's harder for you to exercise, but that doesn't mean that you shouldn't. I just think the same thing that applies to somebody at 64 applies at 74. But this article doesn't agree with that, but I don't accept it. Now, pregnant and postpartum women, it actually becomes even more important to be physically active.
All right.
Now, let me see how many of you can give me the answer to this question before you go down. Okay. What is the one thing that can help you live longer? Now, yeah, what is the thing that can help you live longer? What would your answer be? John, you can't answer. You can't answer. Okay. Tatum can.
Yeah, it's exercise.
Exercise. Okay. Chaplain Thought, what's the one thing?
For me, it's growing spiritually and, following the Bible and helping the unfortunate, those who are poor, homeless, being a servant of God.
Carol?
I would say mental then physical, your mind.
What about your mind? That's garden. I mean, be specific.
Keep mental health, if you possibly can, all those psychosis and everything, and then your physical.
No, but tell me, what about your mental health?
Keeping yourself free from stress and etc.
Daryl?
Sleep.
Sleep. Janice?
Exercise and diet.
Joyce?
Diet.
The answer is...
Dr. Callen, you forgot to ask Bonnie.
Oh, yeah, I didn't see him. Where is she? Oh, yes, she. Bonnie, yeah. What is it?
Diet.
Okay, the answer is, Carol was close, but she circled around it and didn't give an answer. So the answer is optimism. Having a positive mental attitude. You're close, Carol, but no cigar.
Oh, shoot. I wanted to smoke it too.
Yeah, so and sleep is very important, as you all mentioned, exercises as well. But on their studies, and and I think Dallas talked about it, who have they studied, and that becomes an issue. But they found that although sleep and other things are important, that a positive mindset helps with almost everything else. And so that was the one thing that, and as always is the case, as Dal had mentioned before, they do most of their studies on white people. So you have to keep that in mind.
Yeah.
But still.
Well, Dr. Callendar, we had an aunt who lived to be 97, and her thing was that she liked to have a positive optimist, not a pessimistic, and including her husband, anybody that had this pessimistic type of attitude, she did not like to deal with people that were just down and out. She would just get rid of them and kept herself positive and surrounded herself with positive as much as possible.
Yeah, the power of positive thinking. The power of positive.
Yeah. Okay.
Or if you're going to be negative, you can't keep quiet about it. You just need to keep cussing constantly.
Oh my God. Oh.
Girl, where do you come up with this stuff?
Your brother's on top.
That's a good way to keep other people away from you.
And that helps you lower stress.
Yeah, just stay asleep all the time.
Okay, next one. Oh, now this is an article that I thought was important because sometimes we talk so much negatively about Trump. We don't give him the praise he deserves because he certainly lacks integrity. So there's no question about that. But whether this is recorded or not, but he's done some things that are meritorious. He did get the vaccines and free of charge for all Americans, which is something very positive.
How did he do that?
He did it.
How?
He did it. He paid $1 billion to Pfizer and to Moderna.
Operation Warp Speed. That's Warp Speed.
Oh,
yeah. Operation Warp Speed. Yeah.
Oh, okay.
Yeah.
About taxpayers' money.
Yeah.
Of course, but that be that as may, he still did it. So we have to applaud him for that.
Well, that's all right. He applauded himself.
He sure did. Many times over.
So I don't have to do it. He did.
Well, anyway, we have to give him credit for that. He's done some things that are positive. It's too bad that as he ends his reign, he's kind of destroy his positivity because people will remember him as a sore loser.
Yeah.
Mm-hmm.
I just remember him
I always thought he
loser.
was a sore winner, but he's also a sore loser.
Mm-hmm.
And
Dr. Callendar, is he going to move out to the White House or what?
Is he going to do what?
Is he going to move out to the White House?
He has no choice.
He has to.
He has no choice. The only question is when.
Well, if he doesn't move out, then what is going to happen?
We're going to take him out.
They'll take him out. Carry him out.
Be escorted out.
Not a problem.
Yeah, they'll carry him.
They'll carry him out.
Escorted out.
But I don't think it'll come to that. He'll leave in the middle of the night, probably.
He's not going to the inauguration now.
I wonder. We don't know that, but I wonder. Will he be the first president that didn't go attend the inauguration?
No.
Who else didn't attend the inauguration? Who was alive?
John Adams and his son, and somebody else I forgot, with Jefferson, I believe.
Yeah, it was Jefferson.
Well, anyway, I think we have to tip our hat to him for the vaccine.
Yeah, but Dr. Callendar, you were talking about the good things he did, and you mentioned one thing, and
I have to mention the thing that I know. I can't. That's okay. I mentioned one thing. Yeah, that's what this article is about. Is the one thing that he did. He probably has done more than that. He did some things for kidney disease that were important.
You know, Doc, I've seen this already on 4 of the articles we've looked at already, which is the repercussions of that Tuskegee study that's still lingering in our memories. That you know, Black people especially are paranoid still about anything, any government issued medical procedures. You know, so it's got to be a thing. It's real.
You said it. Another source of post PTSD, huh, Darryl?
Absolutely.
Absolutely.
Yeah, okay. All right. Next article. Now, this is a kind of tragic. And that after staff attended a wedding, they brought the virus back to the nursing home, which is frightening.
Oh, gosh. It's horrible.
Yeah. Sometimes we don't realize what we do can affect others.
Washington
just like your grandchildren visiting their grandparents.
Yeah.
In Washington State is where that choir rehearsal first happened back in March?
Yeah.
And 60 people got it.
Yeah.
And that's where the nursing home deaths started also. So it's kind of weird that they wouldn't have learned from that. You know, 9 months later, this is crazy.
Well, when you think about that case we did last week about the Jewish place that had 1,000 people at a wedding and without masks on. So, yeah. I have to go to get my COVID testing, so I'm gonna have to leave a little early today. So,
all right, let's rock on through these.
Okay. We talked much about this. I thought it was nice they had that 90-year-old Black lady who was the first patient.
Oh, she was Black? I thought she was white.
No, she's Black.
Oh, okay.
Black is beautiful. She was
beautiful. Yes, she was cute.
Yeah. First person in the world, they said. I don't know. I thought they were giving out vaccines in Moscow. As a matter of fact, one of our articles.
Yeah, the next article is about that.
Yeah. But it's probably...
There she is. That's the picture though.
She's Black.
Oh, you know, the one in the Washington Post was Black.
Yeah, it was 2. This one, and then they showed another one.
Yeah.
I don't know if one was in the UK and one was someplace else, but they advertised 2. And I thought she was
both 90 years old.
Unless they were saying first white and first Black. I don't know. Could be. You know how they separate us.
Yeah. Okay. So in Russia they began also. It's just that we talk about the West. Okay.
I thought the nurses or the medical field was supposed to be vaccinated first.
That's what I thought.
It depends on the location. You know, you set up your rules, your processes. And here in the United States, they talk about first responders. In England, they talked about the older people first. And of course, Moscow began with doctors, teachers, medical workers.
Yeah, that's...
First responders, that's what they did.
Yeah.
Hold on a minute, y'all.
So this is they're saying the widespread, large scale.
It's still on, Sean. I'll call you back. Bye-bye.
Yeah, it's going to be interesting when it comes available, whether there'll be that much interest in this. But still, nobody compares to us in terms of deaths. We're #1 in the world in terms of deaths.
You see this guy?
Yeah, this is an interesting article. They found a positive And
Oh,
in spite
wow.
of being found positive, they continued to board the airplane, so they arrested him afterwards. They had a child with them as well,
Whoa.
so they arrested him later.
4-year-old.
Yeah, which is maybe why they did it.
Mm.
But it's interesting how nobody compares that in terms of deaths. And once again, nobody talks about the fact that Africa has fewer deaths.
Yeah, that's right.
As Darryl pointed out many times before.
Yeah.
Now, this is interesting. He was the Trump pandemic advisor.
Yeah.
Had no medical experience at all.
Oh my
But he
God.
resigned when his term was up.
Yeah.
But you know, it's interesting how he would appoint somebody like that to be head up the pandemic.
I know. Gosh.
You wonder why. Yeah, why would he do
that? I don't know. That's not positive. We won't talk about that as a positive. That's a tremendous negative as far as I'm
concerned. All right. What about this?
Well, yeah, he took the vaccine rollout to talk about his election and the problems, and so it's pretty sad. Sad what Trump is doing to his position. It's not so much reputation, but what he's doing to the presidency, which is embarrassing.
Very. So, Dr. Callendar, what is he going to do with all that malaria drugs that he brought? Loads and loads and loads and warehouse loads. What are they going to do with
Only
that?
Trump can answer that question.
Yeah, he bought them. We didn't buy them.
So what is he going to do?
That's his problem.
I don't know. We'll find out.
Gonna find a way to charge.
Let's go to the next one quickly, because I'm
okay.
Now, this was an interesting article that talks about how you can use your iPhone and Android to be contacted if somebody that has been close to you tests positive for the coronavirus. But it means that you have to set up your Bluetooth radio signal to be to allow you to find out about that. I don't know any of us who adjusted our phone settings so that you can be notified if somebody that you've been associated with has turned out positive.
Is that what is it? Tracing, contact tracing?
It's different contact tracing, but it's done by a mechanism whereby if anybody's positive that has been close to you, you would be notified. So it's not, contact tracing means that somebody tells on you, so to speak.
Oh, okay.
Whereas the telephone tells. They don't tell, the telephone tells.
Yeah, this would be more self-contact tracing. We've got too many cases in the States to hire people to do contract tracing.
Yeah. But I don't know anybody who's done it, but in places where it's not as easy to get to, I guess that's something.
I have an iPhone and I received a notice on it, push this button. So I thought it was general that they sent it out.
This is about, I don't know if any of you know about macular degeneration that occurs when you get older, but it's a cause of blindness. It's a cause of blindness. And, it is treatable. It is treatable. And it's probably not of interest to people who have not experienced people who have become blind because of macular degeneration. Over 65, it becomes more common.
Yeah, my father had it.
Oh, he did.
Yeah, he actually lost most of his sight because of it. He lost one eye and most of the vision in his other eye.
And it's interesting how smoking exposes to it. And then there's a hereditary factor as well. Is this the last one?
Let me double check. I think the only other, this is the only other one. This just came out this morning.
Oh yeah. This is horrifying.
Horrible. Oh.
Dying, that's dead, not infected, that's dead.
Dead, oh my God.
In one day.
Oh,
one day.
Oh, that's too much. Horrible.
And I think the worst is yet to come.
Oh gosh.
Yeah.
Oh Lord, please.
This is so frightening that many people will, in spite of any other consequences, will take the vaccine when they see these kinds of numbers.
I had a question about being in touch with other people. You know, they're saying people 65 and over shouldn't even go out now.
Yeah.
I can't even get the
I need some work done on my house, and my wife is concerned about having the painter come to do the front door.
Right.
Even though they don't have to come in. What do you think about that?
If they don't have to come in and they're wearing masks, I think it's okay. Okay. But who's to say what's best for the wives? They kind of make up their own rules.
and we must obey.
I'm going to try not to respond.
What do they say for happy life? Have a happy wife.
Happy wife, happy life. That's it.
Deal.
Keep that in mind.
I'm going to live to be old age. I'm going to keep a positive attitude.
Yeah.
Okay, well, I'm going to have to leave. So to our app group, see you again on Monday. And,
Tuesday.
Tuesday. It's Tuesday. What is it?
Tuesday, December the 15th, 2 o'clock.
Okay. Thank you for reminding me. Okay. Tuesday at 2 o'clock. Okay.
All right.
All right.
Dr. Callendar.
Yes.
Right before you leave, I think next Thursday might be